My name is Dr. Geoffrey Mutuma. My background is that I'm a pathologist. Today I want to talk about hypertension. Hypertension is quite common in this country and is developing mainly on young people. First, we don't know the cause of hypertension because 90% of hypertension don't know the cause of hypertension. First, I'll start with defining what hypertension is. Hypertension is increased blood pressure. And normally, the normal blood pressure is between 120/70 to 140/90. So it means that in a normal person, the blood pressure is between 120/70 and 140/90. Normally, when you're checking the blood pressure, there is the top reading and there's a lower reading. The top reading is mainly we call it systolic pressure, and the lower reading we normally call it diastolic pressure. And you must always make sure that when you have hypertension, especially this for people who already have hypertension, when you are checking your blood pressure, you must know what is the upper reading and what's the lower reading, because that's what's important when you're having blood pressure, especially when you're on treatment, because most of the times people are on treatment for high blood pressure and they don't know exactly where the problem is, and sometimes they may take the drugs are not working, the blood pressure is very high, or they are taking the drugs, and then their blood pressure is normal. And it's always very important to know that the hypertension is when the blood pressure is very high, and then there's the hypotension, which is even worse. And this mainly when somebody is taking blood pressure drugs, and this blood pressure is normal, and then the blood pressure goes down. When the blood pressure goes down, that's when you got hypertension. Some people, when you got hypertension, you have no energy and you don't feel as if you want to work and you don't feel that you want to wake up. And this actually, they are very important signs, especially for people who are on treatment. Now, what causes hypertension? We don't know. And nobody knows the cause of hypertension, but we know that most of hypertension is inherited, especially for people who have got their parents or their grandparents have got high blood pressure. You find that actually in that family, we have got so many people who have got also high blood pressure. So high blood pressure is inherited condition, and the most cause of the high blood pressure or the risk of high blood pressure is actually stress, which nowadays is very common, and most people got high blood pressure because they are stressed by so many things, especially for young people around 30 years, 40 years, that actually they are stressed by so many things. But that stress actually is what brings hypertension. In most cases, when people have got hypertension, there are for two issues. The most important thing that most people with hypertension, they have no pain at all. Second is that they've got a mild headache, which sometimes comes and sometimes does not come. Especially the headache comes in the evening and people don't take it seriously. So hypertension, I actually call it a silent killer because people don't have any signs and symptoms, because the headache is normal. People have headache, especially on a working day, and then people have, of course, stress of work and this and that makes people not to take hypertension very, very seriously. And that's why we find that most of the people who have hypertension, they have complications of hypertension without knowing that they have hypertension. Now, what are the complications of hypertension? Because the way I've said, there's no signs and symptoms of hypertension. So what is very important is the complication of hypertension. This mainly for those who have already hypertension and those who are on treatment. And the complication of hypertension, the first and the common complication of hypertension is stroke. Stroke is actually when there is a bleeding in the brain, and sometimes bleeding in the brain occurs in one side of the brain. When it occurs one side of the brain, you've got a weakness on one side of the body. That's your legs becomes very weak, your hand becomes weak, your mouth may turn one side. But when the blood pressure or when the blood is all over the brain, people actually pass on very suddenly. And that's, we call that hypertension or stroke is one of the commonest causes of sudden unexpected death in adults. And that's why you find that you have people who actually have never seen a doctor one day and then they just collapse and die because of stroke, because of hypertension, when it's actually major stroke. For minor strokes, people have got weakness on one side of the body and of course may go ahead and recover, or most people are going to only recover. They normally keep on having that weakness throughout their life. The other complication of hypertension is actually enlargement of the heart, which called cardiomegaly, which because the heart is beating all the time with a lot of force, the heart muscle becomes big. And then the other complications of hypertension is kidney failure, where I find that there's bleeding. The way somebody bleeds in the brain, there can be minor bleeding in the kidney, and people have got renal failure. That's why hypertension causes renal failure. And the other complication of the hypertension is actually blindness, where there's more bleeding in the retina, and somebody can become blind because of hypertension. And that's why hypertension, it has no signs and symptoms, but it damages the most important parts of the body. That's the brain, the heart, the liver, the liver, the kidney, and also the eyes. And that's why as you take blood pressure for hypertension, it's very important to make sure that at least you take care of what is happening with the body, because they have all those complications. What is the treatment of hypertension? The first thing is that hypertension, the way I've said, there is no cause of hypertension. One of the most important things is that when you got hypertension, the most important thing is to make sure that at least you reduce the amount of salt you take, because there are so many people who take a lot of salts in their food. There are many people, when you give them food, the first thing they add salt before even they taste the food, and that's actually increases the sodium, which actually increases the blood pressure. The other risk of hypertension, and this mainly is increase on weight, because the higher the weight, the higher the chances you can develop actually hypertension. The other actually risk of developing hypertension is lack of exercise, and that's why one of the treatment of hypertension is actually to be able to do a lot of exercise every day. We normally recommend every week to do 150 minutes of exercise. That means that 30 minutes every day. So it's important to do exercise, because the treatment for hypertension, apart from weight and eye salt, you need to do a bit of exercise. Now, let us go to the treatment. There are drugs for hypertension, and there are so many of them. And what is very important about the drugs of hypertension is that you make sure that when you discover your blood pressure is high, you start stopping taking care of the risks of developing hypertension, because once you start the drugs of hypertension, these are people who are the treatment of hypertension, that once you start the drugs of hypertension, you don't stop them. So it's very important to note that once you start the treatment of hypertension, you continue using the drugs for hypertension until maybe when you are lucky and you follow your blood pressure, it comes to normalcy normally. But in most cases, once you start the blood pressure treatment drugs, it's not advisable to stop them until a doctor advises to treat them, to stop them. Then you find that the people who have got stroke, people who have got damage of their organs because of hypertension, those who start the drugs, and sometimes, because the way I've said that the hypertension has no signs and symptoms, you find that they stop the drugs by themselves, and then the blood pressure goes high, and they've got all these complications. The worst being stroke, which is actually the way I've said that is one of the most causes of sudden unexpected death in adults. Now, what is the age distribution? First, hypertension used to start from the age of 40, but nowadays what you find that hypertension starts even from the age of 25, 28, 30. I've seen so many people with that very high blood pressure at the age of 28, 30, 32, and that's very early in life. And that's why for anybody, nowadays, we normally say that it's very important to start to be checking your blood pressure. Blood pressure nowadays don't even need to go to hospital, do not need to go to see a doctor to be checked blood pressure. You can buy a blood pressure machine, which is very easy nowadays. It just shows your blood pressure because it's digital. Before you had to go to a doctor, you had to go to a nurse to do your blood pressure, but nowadays you can do it at home, which is quite good. So for those who have got hypertension, for those who want to take care of hypertension, especially for those who have got family history of hypertension, it's always good to have a blood pressure machine, which is very cheap and it saves life. And that's why it's very important. And because hypertension is very common nowadays in a Kenyan population, we have found that in 15% of the people, they've got high blood pressure and they don't know if they have it. So it's very important. Blood pressure is a major important disease nowadays, and it's always important to make sure that you check it, and when you have it, you go for treatment. Thank you very much.